Navtemadlin is a very interesting drug. It is, as you said, an MDM2 inhibitor that has gone the farthest in terms of clinical development in MPNs, currently in phase 3. In fact, they already reported a phase 3. They already reported a phase 3 of it as a single agent in patients with relapsed or refractory JAK inhibitor relapsed or refractory myelofibrosis. And there, the results were just top line were 15% spleen response and 24% symptom response at 24 weeks. While those numbers don't sound particularly high, it's important to remember that this was a relapsed refractory population, not intolerant, but straight up relapsed refractory. And this was a single agent, right? So there's clearly activity. And what they're doing now is a truly unique, remarkably designed trial where it's really for a suboptimal population, a suboptimal responder population. But the difference is that all patients sign consent before ruxolitinib initiation. So then they start ruxolitinib and they go 18 to 24 weeks. And if they have a suboptimal response at that point for both spleen and symptoms, that's when they add navtemadlin or placebo. Now, this is called the POIESIS trial. So there is no other trial, frankly, in the field that has this sort of a design. And what is unique about it is that this perhaps, I mean, of course, we need to wait for the results, but this, I think, allows the sponsor, Kartos, to really isolate, if you will, the suboptimal population, because everyone's sort of starting at the same time point. It's not like someone's been on Rux for 3 years and someone else has been on Rux for 6 months. Everyone is starting at this sort of the same baseline, and then 18 to 24 weeks later, if they are suboptimal, they are randomizing to navtemadlin or placebo. So I think this is a truly unique and perhaps a more precise way of looking at suboptimal response. So really excited to see what that shows. Of course, the downside of doing it this way is that they need lots and lots of patients, because many of those will not be suboptimal, happily, and will not be randomized. So there is that aspect, but otherwise a very exciting trial. But getting back to your question on the disease modification piece is, I think, what you asked about, right? So naftamadlin again has shown us a number of very compelling and also somewhat unique correlates. So, like other drugs, it has shown reduction in cytokines, the cytokines that really matter, like TNF alpha, IL-8, things like that, the ones we know are bad. But also, variant allele frequency reduction of the driver mutation, as well as bone marrow fibrosis. But somewhat uniquely to naftamadlin, they have this interesting, intriguing correlation between circulating CD34 cell count, reduction in that, and clinical response, which I'm yet to see with any other drug. So they have that, and then they also have robust reductions in cytokines, bone marrow fibrosis, and driver mutation allele burden.